because there's overlapping drivers in both systems: poverty, mental health, substance abuse, trauma, abuse, lack of access to preventive care. So there are differences. And if I had longer than 10 minutes, I'd spend more time being more nuanced. But I don't. So I want to focus on what's the same. Here's what's the same. Both fields are dealing with very fundamental questions. How do we improve outcomes? Right? How do we reduce disparities? We're talking about two systems that also require a lot of resources in this country. A lot of taxpayer money, a lot of human resources, a lot of institutions. We're talking about really big business in both instances, big systems that have a lot of things driving them. And we're talking about two systems that routinely fail to take into account the cow's eye view. So, what can livestock building systems and handling systems teach us about improving medical care and about improving the justice system? If you took the Facebook quiz, you saw these questions. If you listen, maybe you'll do well on the quiz. I don't think you get a prize, but you know, there's something. So you guys were supposed to laugh a little there. It's not that funny. That's okay. I'm going to get a little funnier later because I get a little more serious and you have to be funny first, so it kind of makes it easier to take in the hard stuff. So in explaining her revolutionary redesign of livestock handling facilities, Dr. Grandin, the person I mentioned before, says the following, and I'm reading an excerpt from her book called Thinking in Pictures, which I highly, highly recommend. It's an account of living with autism and the way she sees the world and her work. And Dr. Oliver Sacks writes the foreword, and he talks about what he's learned from her. It's a beautiful book. And she says this: early in my career, I used a camera to help give me the animal's perspective as they walked through a chute for their veterinary treatment. I would kneel down and take pictures through the chute from the cow's eye level. Using the photos, I was able to figure out which things scared the cattle, such as shadows and bright spots of sunlight. A dip vat is a long, narrow, 7-foot deep swimming pool through which cattle move in single file. It is filled with pesticide to rid the animals of parasites. Existing designs before her work were very poor. The animals often panicked because they were forced to slide into the vat down a steep, slick concrete decline. They would refuse to jump into the vat, and sometimes they would flip over backward and drown. The engineers who designed the slide never thought about why the cattle became so frightened. The first thing I did when I arrived was to put myself inside the cattle's heads and look out through their eyes. Because their eyes are on the sides of their heads, cattle have wide-angle vision. So it was like walking through the facility with a wide-angle camera. Dr. Grandin knew that cattle willingly walk down ramps that have cleats. They provide secure non-slip footing, so she factored that into her design. In her own words, if I had a calf's body and hooves, I would be very scared to step on a slippery metal ramp. Dr. Grandin also realized that the animals who had just been dipped became excited and created problems when they saw dry cattle nearby. She likens it to school kids who see their friends somewhere else doing something else, like in a playground, so she put a wall up between them, so the dipped cattle who'd come out of the pesticide ridding bath didn't see the dry cattle. This totally changed their behavior and reduced overexcited cattle, creating, I guess, cattle stampedes in the facility. It shouldn't be lost on us that Dr. Grandin is autistic and has intentionally worked her whole life to learn to understand human emotion and how other people think. And yet, or perhaps because of that, her work speaks to what is fundamental and teaches us what is fundamental about both humans and animals. Now, this is a lot of time in a short talk to be talking about cows, because this is a talk about medical system and for me about youth justice, and you might be thinking, well, this woman seems smart enough and she seems okay, but why is she talking to us about cows? You may also be thinking, it's almost lunchtime, I need more coffee, when is this over? But I think this is where I'm about to make a really silly joke to try to get a little laughter before we get into the hard part, but I think it would behoove us to take Dr. Grandin's revolutionary yet very simple perspective to heart and to practice. The last section of the talk, and the one I want to conclude on, is entitled, "What does this all have to do with disparities?" Or, humanity provides the answer. So, I'm going to show a few photos while I talk. Now, these are photos of juvenile detention facilities throughout the United States. And they're taken by Richard Ross, who's a fantastic photographer, and they're from all over the country. So, and you are shackles, which I'm going to speak about in a moment. And Richard Ross went through facilities all over the country, and he took photographs of kids inside of them. And you can go to his website, which is called Juvenile Injustice. And you can look, there's a ton of these really powerful photographs, and he has a whole project also on girls in the justice system. So I'm just going to show a couple more because it's a little bit tricky when But I want to talk about what I experienced working in the justice system. So I worked in family court. That led me to coming and wanting to do the kind of systemic work I do now. And I was once in my office inside the family court building, and I saw a 13-year-old girl walking down the hallway, and I remember very clearly, and I often talk about when I speak publicly, watching her walk, because what struck me, she was wearing these navy blue dress shoes. And she had white ankle socks on, and her shoes were pumps. They were low-heeled, and they were scuffed. And I remember thinking that they looked like her best shoes, like she put on the best pair of shoes she had to come to court. But the other thing that I really remember is that she had chains around her feet. And her feet were chained together, and she was also handcuffed. And her handcuffs were wrapped to a leather belt, which was around her waist. And I remember the sound of her chains scraping on the floor as she walked by. And this was inside a building called Family Court. This is a place where we're supposed to help families. This is a place we're supposed to help children. Practices like this have an impact on children. They also have an impact on families and on communities. Again, I'm not saying that this is identical to how people are treated in the medical system. But what I'm saying is that fundamentally there's something in common in systems that don't think like the people who go through them. I think for different reasons, right? In dealing with incarceration in America, there's a whole host of ideological reasons that we think it's okay to treat people like that. There's also a lot of reasons we think, wrong reasons, but reasons that we allow this country to incarcerate children, particularly black and brown children, in conditions that are brutal and inhumane, and don't pass any standard of human decency. So racism is one of the things that drives the American justice system. But we need to think about collectively how we create social systems and how, as practitioners, how you, if you become a doctor or a nurse or a hospital administrator or a professor or anyone who's going to interact with people going through a system, be it the justice system or the medical system, can we think like the people who go through that system? Can we widen our eyes? Can we have wide-angle vision and say, what does it feel like to be wheeled down the hallway in a stretcher? What does it feel like to be in a gown? And there are many stories. You will see them in public discourse about doctors, often later in their life, who become a patient, right? And there was a famous book and a movie written like this, but it's happened other times, and all of a sudden, the doctor realizes what it was like, and that maybe what they were doing was not healing after all. But we shouldn't have to wait for that. We don't need doctors to get sick to realize that what they're doing isn't always healing. And we don't need people to become incarcerated to realize that this is not good and this doesn't lead to better outcomes, that children who are chained are not going to grow up very likely to do better things in the world, that when we put children in solitary confinement and we handcuff them and we shackle their feet, what we're teaching them is not that they're worthy. We're not teaching them how to be better citizens. We're enforcing a sense of degradation and inhumanity and of unworthiness that will lead to worse outcomes for all of us. Incarceration is a public health problem. Putting children in solitary confinement is a public health problem. Chaining children is a public health problem. The way that we treat people who go through the justice system is a public health problem. This is all allowed to happen. It's encouraged by a belief that these aren't children, that they're not human beings. That lie is fueled by race and racism. And there are important parallels for the medical system. And I will end where I began by talking about Dr. Grandin, who taught us that if we want to improve systems, if we want better outcomes, It's our own eyes we have to adjust. We have to widen our lens. We have to imagine ourselves, our own children, someone we love going through the system. And the central principle we must follow is to acknowledge the humanity of the people inside the system, to design systems and buildings and operations and staff trainings and standards of care, to design everything around this principle. That is how we help other people heal. That is how we heal ourselves, and that is how we as a nation will heal. Thank you.